Hi, this is Herb Chase, and I'm going to talk about the best resources for diagnostic reasoning. You're going to start your cases soon, and you'll be analyzing the cases to see if you can come up with a differential diagnosis, and then maybe narrow down the possibilities to one or two. First, a little review of clinical reasoning. Here are the steps in clinical reasoning and the skills that you're going to be working on over your 4 years in medical school. Obviously, take a history and a physical, engage in diagnostic reasoning, come up with a working diagnosis or differential diagnosis, perform some effective testing to narrow down the diagnosis, engage then in patient-centered decision-making to decide what the best outcome would be, or the best therapy would be. All of these skills are powered by best evidence. Today we're going to be focusing on diagnostic reasoning. The learning objectives from this podcast are quite straightforward. After listening to the podcast, you'll be able to discuss the diagnostic tools available to form a differential diagnosis. Here at the library we have Isabel. You'll be able to describe the best general textbooks where you learn about the signs and symptoms of the potential diagnoses, and that helps you rule out some diseases and rule in other diseases. And lastly, we'll briefly show the databases for medications. So let's start out with a case. We have a 62-year-old woman. She comes to the clinic complaining of increasing fatigue and weight loss over the past year. She used to be active, but she can barely walk up the stairs. And over the past 6 months, she has lost 10 pounds. 1 year prior to her visit, she was in good health and without any chronic diseases. She has some depression in the past. Her chief complaint, obviously, is fatigue and weight loss. When you do your review of systems, she tells you that not only is she fatigued and have weight loss, but she also gets dizzy when she stands up. We would call that orthostatic dizziness. And she's also noticed that her skin is darkened in areas that are not exposed to the sun. Lastly, she's noticed a loss of body hair, including pubic hair. So, on physical examination, you pay close attention, special attention to follow up on some of her complaints. You take her blood pressure standing up to see if in fact she does have a drop in blood pressure that's orthostatic hypotension. And you look at her skin to see if there's increased pigmentation and there's pubic hair loss. Here we are at Columbia's website, the homepage for the library. I understand that it's going to be revised in a couple months, so it won't look like this, but we'll have basically all the same links. And we have our top resources here on the right. I'm sure some of you have already explored these in prior exercises. And we're going to get to Isabel by pressing More Health Science Databases. And we're going to scroll down and we're going to find Isabel, Differential Diagnosis Support System. So let's move to Isabel, where I've put in the signs and symptoms already. The patient complained of fatigue, weight loss, orthostatic dizziness, and loss of pubic hair. She is younger than 64, she is not pregnant, and she's a female. And Isabel asks you to put in the signs and symptoms, and then you can hit checklist, and you get a beautiful differential diagnosis of possible causes, ranging from adrenal insufficiency to renal failure, Crohn's disease, Hodgkin's disease. All these are possible given her rather non-specific complaints, although the loss of pubic hair is actually a major clue. You can see that the categories of the possible diseases ranges from neoplastic to endocrine, immunological, and we can get the entire list. Those are just the top 10, and you'll see that the way down at the bottom, which are unlikely, brucellosis, are on this differential. And then you can also hit the red flags button, which shows you important diseases that you really don't want to miss. So we've got a whole bunch of important diseases. We have many important diseases, and how are we going to read about them? We need to read about several of them in order to get an idea of what are the causes of these signs and symptoms. So if we click on, let's say, primary adrenal insufficiency, we see that there are many outstanding resources linked in Isabel on the left side, and the default is Dynamed. Dynamed is a terrific upper-level resource that covers evidence-based guidelines, diagnosis, treatment, as well as testing. But I'd like to focus you on all these other resources. And we just ask, what are the best resources here? There are many different ones, clinical queries and clinical key and micromedics. So let's just take a sidebar to resources. Let's ask ourselves which resources are the most helpful. So I'd like to give you a little bit of an overview of the natural history of medical information. First, there's the single study exploring a single hypothesis. It could be treatment, it could be testing, it could be diagnosis. And after several years, there are many single studies exploring the same hypothesis. And at that point, the hypothesis is not necessarily proved. There might even be conflicting results. Eventually, if there are enough studies on the topic, a systematic review is completed where all the studies on the topic are analyzed together, and a conclusion is reached as to whether or not there's sufficient evidence or not to support the initial idea. If there is enough support and the systematic reviews conclude that the hypothesis has been proved, the drug works, the lab test does identify people with the disease, then the results and the conclusions are incorporated in a textbook. It has passed the test of time, and the textbooks generally are considered the most reliable information. It's a dogma to some extent. So this concept of least reliable, most reliable, single study ranging to textbook is best represented as a pyramid. This is the evidence pyramid. At the top, we see the most reliable resources, that is, evidence-based clinical practice guidelines and textbooks. And at the bottom, we see the least reliable information, which are the individual studies, as I mentioned in the previous slide. And somewhere in the middle are the systematic reviews, the syntheses. If an idea has just been proposed, it's in studies. If the idea has been reproduced by many different investigators, it will be observed, it will be concluded in a systematic review that the idea has some legs, and then once everybody agrees to it, it's in the textbook as a summary. There is a level above textbooks, which is computerized decision support. There are few examples of this, but we see in the next 10 years that bulletproof guidelines will be integrated into the electronic health record and make it easier for practitioners to follow and not even have to look up what the information is in the textbook. Now that we've explained the evidence pyramid, let's look at the Isabelle links and see where they map to. We have resources such as Dynamed, Up-to-Date, and Access Medicine that map to the electronic textbooks, and we're going to explore that in a second. We've got systematic reviews, which map to the systematic review level. There's also Cochrane, which is not on this list, but should be soon. And then we have the general search queries that look at PubMed. Certainly for diagnostic reasoning, we stick to the textbooks. We don't go to PubMed because that is fraught with uncertainty, and even systematic reviews, which focus mainly on therapy, would not be appropriate. So for this exercise of figuring out what the patient has, we stick to the electronic textbooks. Here we are back at Isabelle, and we've clicked the adrenal insufficiency in adults button, and we'd like to read about adrenal insufficiency. As I mentioned, Dynamed is the default, and there's plenty here. There's background, there's evaluation and testing, there's diagnosis. We can ask what are the major history and physical findings, and we can click clinical presentation. We see the symptoms: fatigue, loss of appetite, weight loss, nausea, vomiting, muscle and joint pain, skin hyperpigmentation, salt craving, postural hypotension. These are all signs and symptoms that the patient complained about. Now we can also go to Up-to-Date, which is equally useful. One of the Up-to-Date has many different topics, clinical manifestations in adults, and here we see the same listing. It's actually got along the left panel here. Access Medicine is also terrific. So based on what we've read, it seems like the best bet for that differential diagnosis is adrenal insufficiency. However, the more you read about the conditions, you need to also read about the other diseases on the differential diagnosis list to rule them out, perhaps. And you should always remember to reserve the right to change your mind. This is not something that is easy to do. You get invested in a diagnosis and then you don't want to give it up. But the more you read, the more likely you are to change your mind if appropriate. I'd like to end this podcast with a reminder that medications can cause the same signs and symptoms of various conditions. In this particular patient, she complained of fatigue. That's a well-known side effect of antihypertensive medicines. She complained of weight loss. That's a well-known side effect of antidepressants. She complained of skin pigmentation in areas that are not exposed to the sun. That is a known adverse event associated with the non-steroidal anti-inflammatory drugs. And lastly, she complained of hair loss, which apparently, I didn't know this beforehand, is a side effect of statins. Where does one read about the side effects of a drug? In fact, where does one read about a drug in general? This will become very important to you when you're looking to prevent patients from being prescribed true drugs that interact with each other. The best resources are here, Micromedics and Lexicon. So let's take a look at them. So let's go to Micromedics or Lexicon, and we're back at the Isabel site where we see the links to these two resources. Let's click Micromedics, and here we are at the Micromedics site. There are a lot of different. There's a lot of different functionality. We can look for drug interactions and IV compatibility, and so there are many useful tools here on the Micromedics site. So we'll just type in one drug just to show you where we can find the side effects. For example, let's type in simvastatin. And we see a long list of really useful links. We see what the FDA thinks you should use the med for. We see the contraindications. We see the adverse events, which we'll click here just to get an idea of how this works. And here are adverse events for simvastatin. In this podcast, I've given you a look at the best resources for diagnostic reasoning. We include diagnostic tools. Isabel, there are others out there. Isabel is the best. Isabel also has the links to all those great resources that I've pointed out, especially the best general textbooks where you can learn about the signs and symptoms of a potential diagnosis and the rest of the diagnoses on the differential diagnosis. I've also shown you the resources for medications. Thank you, and I hope that you have a great time working on